Hi, everyone. I'll give just about a moment or so to let everybody trickle in, participants join. Thanks for being here. All right, in the interest of time, I will go ahead and get started. It is 1:01. Hello, everyone. My name is Brianna Montgomery, and I would like to welcome you to the Autism Intervention Research Network on Physical Health, the AIRP March 2023 webinar. Thank you all for joining us today. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the Q&A feature or in the chat box on your webinar console. Just a friendly reminder to please be respectful when communicating in the chat and asking questions, and note that only questions or comments pertaining to the presentation will be addressed. This entire webinar is being recorded and will be available on the AIRP website, which I will put in the chat. You may also view the presenter slides to follow the presentation on our Google Drive archive. I will also put in the chat. There will be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide suggestions for future webinars. In the interest of time, let's get started. You guys want to go ahead and share your slides? Perfect, thank you. And then actually next slide, please. We want to first acknowledge the Health Resources and Services Administration as the funding source for the AIRP. It is my honor to introduce our presenters for today, Calliope Halling and Maggie Johnson. Calliope is an assistant professor at the Center for Autism and Related Disorders at Kennedy Krieger Institute and the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. Her research is broadly focused on how to improve the physical health, particularly the gastrointestinal health, of individuals with neurodevelopmental conditions, especially autism. Maggie is a PhD student at Emory University School of Nursing. She has worked at Children's of Atlanta as a behavioral emergency response nurse and is interested in how to improve nursing curriculum to prepare nurses to care for autistic patients and how to improve experiences for autistic patients across the lifespan as they interact with the acute care setting. Please join me in welcoming Calliope and Maggie.
Thank you so much, Brianna, and thank you for having us. We're really pleased to be here presenting on this project. So just a brief outline for what we're going to talk about today. I'm going to begin with a very quick overview of what is currently known about GI symptoms in autistic adults. And then we're going to move to the study itself called GI Wanna Talk About Autism. We'll talk about what our study goals are, introduce our study team, talk about the different activities and phases of the study, present some results from our screening survey, some preliminary findings from our qualitative interviews, as well as some preliminary recommendations that our team has drafted on how we think as a field we can improve the GI health of autistic adults. And then we'll close with some next steps for this project. So what is known about GI symptoms in autistic adults? I should preface this by saying there is very little research, unfortunately, on GI symptoms in autistic adults specifically. So we know that in autistic individuals, mostly children, GI symptoms tend to be very common. So there are dozens and dozens of papers at this point highlighting that GI symptoms like constipation, diarrhea, reflux, abdominal pain are quite common. And the estimates that you see at the top of this slide are from a literature review cited at the bottom, the Holding et al. 2018 paper. This is part of my dissertation, and this was a sort of meta-analysis of the existing epidemiologic literature on autism and GI symptoms. And what we found is that dating back to literature from 1980, there was an elevated likelihood of many of these GI symptoms. And so on average, 22% of study participants had constipation, 23% had diarrhea, 14% had abdominal pain, and nearly half had one or more GI symptoms. These symptoms are commonly accompanied by other issues like food sensitivities or preferences, difficulties with mealtime or toileting, as well as a number of co-occurring conditions like stress, anxiety, seizures, sleep disorders, and behavioral and sort of behavioral health markers like poor quality of health, worse health perception, and less physical activity. It's important to note that there's currently no evidence for an autism-specific gut pathology. And so what that means is that even though we see that these symptoms and conditions seem to be elevated in the autistic population, there isn't a specific condition that is, specific to autism. It seems that these conditions that we see in the general population are simply more likely to be seen in autism. And as I noted at the beginning, most of the research is in autistic children. There's very little that's been done in adults, and that was part of what motivated this study. So this is a simple schematic, but I think it makes a couple important points. I apologize, you may hear my cat meowing in the background, is that having autism or being autistic may increase the likelihood of having GI issues. And there are a few ways through which this can happen. First of all, let's consider diet. So it's very common for autistic individuals to have somewhat restrictive diets. So for example, avoiding entire food groups or particular food textures or food colors. This could be because of sensory sensitivities or because of prior negative experiences with particular foods or sensitivities to particular foods. And so the result of this can sometimes be lack of adequate fiber or malnutrition, which then can exacerbate or contribute GI issues. Similarly, if we consider some of the co-occurring conditions that are common in autism, things like anxiety, poor sleep, or seizures, these conditions themselves may increase the likelihood of GI dysfunction, and sometimes the medications that people take for these conditions can also increase the likelihood of GI dysfunction or GI symptoms. Conversely, we can consider that the gut itself may actually increase the likelihood of behaviors that we commonly see in autism. And so the bottom pathway, which I've loosely termed biology, is outside of what we're going to talk about in today's presentation, but includes things like the microbiome and metabolites, the vagus nerve, the autonomic nervous system. And so I just wanted to mention that those are important to consider. But what I want to focus on is the top part, where we see that having a gut dysfunction or GI symptoms intuitively will cause discomfort, distress, or pain. And in the general population, this is certainly true. And then in autistic individuals, particularly someone who may have difficulties with interoception or alexithymia, or with communicating to a caregiver or a healthcare provider that they're experiencing distress, some of that distress may show up as irritability or anxiety or even aggression. And so the point that I want to make here is that it's important to consider that behavior can actually be a signal for medical distress, and in this case, symptoms of gastrointestinal distress. And then I think it's also worth noting that there are important obstacles to having GI symptoms recognized in autistic individuals. So as I mentioned, it's common for people to have impairments in interoception. Language impairments are, of course, common as well, as is intellectual disability. And all of these things, which are intrinsic to an autistic person or some autistic people, may make it difficult to recognize when one is having GI symptoms and then to communicate that to somebody else. Of course, there's the larger social and environmental world context. Things like ableism, diagnostic overshadowing, and a scarcity of trained providers that exacerbate these issues. And so a point I want to make is that we need tools that are specific to neurodevelopmental disorders, conditions like autism, for assessing GI symptoms. And these need to include objective signs that are easy for people to detect, rather than just subjective symptoms that are self-reported. This has really important implications for both research and clinical care. So next, we'll move to talking about the study itself, and I'll hand it over to Maggie.
Thank you, Calliope. I'm going to talk about our study goals, as well as an overview of the study itself. So our goals were twofold. The first one being really understanding and describing the lived experiences of autistic adults with GI symptoms. Our second goal was to develop a list of recommendations and to improve the GI health of this population. So those are our two main goals, but overall, we were really focused on creating a participatory approach for this project. Creating a community board that had both autistic and non-autistic adults, so we could capture a more diverse perspective on all the feedback that we received throughout this process. We had a participant-facing team of 5 members: Calliope, myself, Maggie, Catherine, Kelsey, and Faith. We'd like to mention that 4 out of the 5 of our team do identify as autistic or neurodivergent. We were able to comprise a community board of 24 members. This is a general breakdown. We had 6 autistic adults, 6 parents or siblings of autistic adults, 10 healthcare professionals in different areas, and 2 autism researchers. I'd like to mention that these aren't mutually exclusive, and that several members identified in more than one category, but this is like a general breakdown. Our mentor was Dr. Liz Policano. This being Calliope and I's first study like this, we've been so fortunate to have her work alongside us throughout this process. She's been with us several times, kind of giving feedback on all aspects of the project, including our coding and interpretation process. So we're very thankful for that. So this is just an overall kind of map of sorts of our project, but really starting out with the core of developing our study team. I spoke earlier about the study team, but I just want to stress how much time and thought went into developing our team. It was very important to Calliope and to myself to form a really well-rounded community board. So we wanted a lot of different medical professionals giving feedback, be it a nutritionist, a GI specialist, a pediatrician, a developmental pediatrician, a pediatric nurse practitioner. We had a really strong mix of people, and as well as autistic adults and caregivers or siblings of autistic adults that could give really meaningful feedback throughout this project, and to kind of maintain this really well-rounded whole person perspective of the board's decision and their feedback. So once we had the study team, we moved into our recruitment phase. The community board did provide feedback on all recruitment materials, as well as like recruitment flyers, and even on the screening survey itself, as well as the interview guides that were later developed. But from this screening, we were able to get the information we needed to get a diverse sample for our interview. So once we had our sample, we went into interview 1, and this was kind of meeting our primary or number 1 goal of understanding the lived experiences. So we asked open-ended questions in kind of a semi-structured format during this interview to really understand the experiences and difficulties that our participants had with GI symptoms. From there, we moved on to analysis. I'll go into more detail later on that, but during this time is where we started to gather and identify our themes and start to pull information to create our preliminary set of recommendations. And our recommendations, again, was a very iterative process with the study team and the community board, kind of refining and shaping out what our preliminary recommendations would look like. And that being our second goal of creating this list. So from there, we are doing a second qualitative interview with the original interview participants. This will really provide specific context from the participants on what they would accept or reject in this first set of recommendations. And additionally, provide really specific feedback on the practicality and application of the specific suggestions and any modifications that would need to be made. This is, again, a really important participatory process. And so it was important for us to hear from the original participants in the first interview to get, their feedback on the recommendations we developed from their interviews. But from that, we acknowledge that this is a very small group of 26 individuals. So we plan to do a survey of 700 individuals to get a better answer from a larger pool of participants, to kind of understand what a larger portion of autistic adults would feel about these preliminary recommendations. During this time, during the survey, we'll collect general demographic information about these people, as well as clinical information. And through this, we can kind of tailor recommendations to specific groups that, you know, may be more or less inclined to adopt a certain recommendation. Like if really young autistic adults are really positively giving feedback on one recommendation, and parents or older autistic adults negatively on the same one, we can kind of know which group to send these particular recommendations to. And from those, the qualitative interview and the survey, we will then have a more refined set of recommendations that we can use towards dissemination. And overall, again, just to stress again that every step of the way we communicated with our 24 board members, and they provided, you know, ample feedback throughout this time. I'm not going to go into more detail on some of the steps that I just described in this in our little map. So recruitment took place over social media, as well as local autism centers, and within the study members' own social networks of autistic individuals or parents that they may have known. Yeah, thank you. Eligibility for our participants was identifying as an autistic person or person on the spectrum, but they did not need a formal diagnosis. They must be 18 years or older, have had gastrointestinal symptoms now or in the past, live in the United States, understand spoken and written English. If an autistic adult could not complete the interview by themselves, their parent could help them answer questions. But I also want to mention that parents themselves could have completed the survey and reached out on behalf of their adult autistic respondent. We used a Qualtrics screening survey to collect demographic and GI or clinical related data, as well as field for accommodations that any participant would need to fully participate in the interview process. The results of this interview, like I said earlier, were used to select specific participants for our interview. We had 186 total responses on the screening survey, and from those, we selected 26 for interview. 21 were autistic adults, and 19 did have a professional autism diagnosis. We had 5 mothers of autistic adults, and we did have 1 mother that completed an interview with their autistic child present. The mean age for our participant was 30 years old, and the mean diagnostic age was 17. We also asked for autism terminology preference, and more than half preferred autistic person, 21% preferred person with autism, and 12% person on the spectrum, and then 12% we left an open box for them to say what their preference was specifically. We had a pretty good mix gender-wise of 42% men and 42% women. We did have 16% non-binary, genderqueer, or gender non-conforming. We had a good mix between male and female, and then racially, we did have a predominant amount of white participants, which we acknowledge is skewed, but in our survey that we anticipate doing with 700 autistic adults and parents of autistic adults, we're hoping to capture a more racially and ethnically diverse sample in that time. So here's some other demographic information that we collected. We did have a majority, like 31% bachelor's degree, 27% graduate degree, and 62% of our participants were employed. Majority were living with their parents or with a spouse or partner. And about a quarter of our participants had a household income of less than $15,000 per year. So we also asked about like GI or clinical specific information in order to further screen. So we asked, over the past 3 months, had you had one or more symptom or had to take a medication to prevent symptoms? And of the respondents, 96% said yes, they had had some GI symptom or had to take a medication. Of those respondents, 58% did have a formal GI diagnosis. And of those that had a GI diagnosis, 73% had IBS or irritable bowel syndrome, 40% gastrointestinal reflux disease or GERD, 20% chronic constipation, and 13% Crohn's. And again, these aren't mutually exclusive. This is just a general breakdown, but some people may have identified as having GERD and chronic constipation, or a mix of those. We also asked about frequency of impairment, and 50% said at least some of the time they experienced GI symptoms. Or symptom impairment, sorry. So we did have 4 interviewers to perform these in-depth semi-structured interviews. They all took place via Zoom or an audio format of Zoom. Once they were transcribed verbatim, we sent them to participants for their own review for accuracy and for approval, and to make any changes that they felt necessary. We offered multiple formats, but a majority chose to do video. And like I mentioned before, we asked for accommodations that participants would need. We offered a drop-down menu to select different types of accommodations, as well as offered kind of an open-ended box for them to fill out any other accommodations they felt they would need. A majority wanted closed captions, the questions sent in advance, or a chat box utilized during the Zoom session. It was important for us to send questions to in advance. We thought about doing that before, and so we ended up sending everyone questions in advance, regardless of them requesting that as an accommodation. We also offered to do multiple interviews if that would be helpful. So 4 15-minute, 2 30-minute versus the 1 60-minute interview. We had 4 individuals select this, but only 1 ended up using the multiple interview format. And overall, the average interview lasted 36 minutes. Here's an example of some of the questions that we asked, some of these kind of open-ended questions where people could really kind of dig into their own experiences. So giving a brief history of their GI symptoms, or if they had any sort of sense of what could trigger these GI symptoms, as well as any of the bidirectionality that they see between their autism and the GI symptoms that they experiences, and any interactions between the two, how they personally have managed their symptoms now or in the past, and then if they ever sought professional treatment or medical treatment for their GI symptoms. So in the beginning, I mentioned our 5 patient or participant-facing team members, and these were the same that helped with the analysis process. So each of the 5 of us read 4 interview transcripts per week, and then we all met as a group, a 5-person group every week, and discussed each transcript. We all collectively came up with potential codes and themes using an inductive bottom-up approach. It was through the same weekly and iterative process that we created the final code book. And we used this to kind of consolidate and refine all of the codes. Currently, Catherine is performing a formal analysis using this interpretive phenomenological approach, but that is ongoing. I do want to mention, we've just been kind of blown away with the complexity, the richness, and kind of all the information that has come from this interview with participants. It's very evident that at this time, we think we have enough to produce 3 to 5 qualitative manuscripts just on this lived experiences and information alone from interview 1. And I want to mention again, Dr. Pelicano has been, a really invaluable resource during this qualitative analysis part of our research project. Her extensive expertise in this type of research has been very helpful as we move towards dissemination. And I'll pass it back to Calliope.
Thank you so much, Maggie. So as Maggie stated, the formal qualitative analysis is currently ongoing. So one of our team members, Catherine Almendinger, is working through those transcripts using that final code book that we created as a team. But what we want to share today are some of the preliminary findings from the qualitative interviews. And so what we'll share are 4 overall themes that we found from the data. And then for each of the themes, we'll present some quotes that we feel exemplify each of the themes. So theme number 1 is that in many instances, for many of the participants, GI symptoms seem to have really profound and extensive negative impacts on all areas of life. So here are a couple quotes that demonstrate that. The first one is from an autistic adult. They say, in high school, I would have food while I got on the bus, eat, and I would be sick for a few hours after that because of having to eat early. Then in my 20s, I got down to about 85 pounds when I was 24, which is not okay for someone my height. I should have been 110 pounds. I was skin and bones and I couldn't eat. I would nibble about 3 saltines a day. I didn't know why. I felt like passing out constantly. I would just lay on the couch and rot, and I just couldn't eat. I couldn't function. The next quote states, it impacted things pretty negatively. I had to leave class in the middle a lot of the time. I had to leave my friends during socializing. It wasn't debilitating to the point where I wouldn't go out or anything like that, but it was definitely a notable inconvenience. I spent a lot of time in the bathroom at that point in my life. So both of these quotes, I think, are really speaking to the impacts that these GI symptoms could have, whether it be impacting the ability to eat and maintain a healthy weight, to function in school, and to socialize with friends. So a lot of different life domains being affected by this GI distress. Some more quotes that speak to this theme. I don't know if I'll be able to hold down a full-time job or not. Will I ever be able to date or do anything? So again, speaking to the many varied domains that could be impacted, including employment and dating. And then this last quote that we'll share for this first theme is from a parent stating, well, what I notice is when he has diarrhea, he's much more lethargic, so not as active as usual. And then when he has constipation, he doesn't sleep. So because he doesn't sleep, he gets hyper, contrary to other people that when they don't sleep, most people, when we don't sleep, we're tired. When he doesn't sleep, he gets totally hyper the next day, like crazy. So again, speaking to the effects that these GI symptoms can have, and in this case, what I think is important to point out is that we know that there are a lot of co-occurring issues in autism. So things like sleep and hyperactivity. And this quote is speaking to both of them, the impacts that the diarrhea or the constipation have on this autistic adult's energy level and ability to sleep. The next theme that we found is that there were common triggers of GI issues. These included stress, sensory overwhelm, and changes in routine and food. Though it's important to know that triggers were not always apparent to autistic individuals or their parents. And so here are some quotes that speak to that. This first autistic adult says, that's been a frustrating part of it, is that it doesn't seem to be linked to anything specific. So imagine the frustration that someone might face of having these chronic and debilitating GI symptoms and simply not being able to identify what's causing them. And this is unfortunately something we heard quite a bit. The next person says, I do know that what I eat affects the probability of how bad it's going to be the next day. And dark green vegetables are the worst. I mean, foods I know to be relatively safe are highly processed, like white bread. And I like the cream of wheat cereal. I ate that almost exclusively for a while because it didn't make my stomach hurt as much. I think what's really interesting about this quote is that it speaks to how these GI symptoms can really profoundly influence diet. And so this person having to move away from more nutritionally rich foods like dark green vegetables to foods that are sort of more highly processed like white bread or cream of wheat cereal, simply because that's what they could tolerate. This next quote reads, I do remember feeling bad, but it was from stress because going anywhere, doing anything stressed me out because I was selective mute. That always just means pressure to speak. Someone harassing you, strangers telling you your hair is beautiful and putting you on the spot. Life was just so extremely horrible. It was just unbelievably horrible that my only memories of doing anything are when I felt like I was going to vomit. And this one is very hard to read. The fact that this person felt pressure to speak and, intense anxiety, and that was a major trigger for them of their gastrointestinal distress. And this last person says physical activity, especially walking or running, that definitely triggered it pretty badly back then. So our third theme is that unfortunately, most autistic adults and their parents described primarily frustrating and unhelpful healthcare interactions. They found the system difficult, unpleasant, and expensive to navigate, and felt healthcare providers were often dismissive and did not offer useful diagnoses or advice. So this first quote is from a parent, and she said, "I have yet to find a provider that has any idea how to help us." This is something we unfortunately have heard over and over from participants. This next quote is from an autistic adult. "They set me up with the nurse practitioner who was very nice, but I feel like I haven't actually had a medical opinion that I trust, and there's been no reasons really offered. They did a lot of blood tests. There were a lot of speculations, but there's so far been no reasons at all why I should have the GI problems I do. That said, because of the medications I take, there doesn't necessarily have to be a reason. It could be like I've been on lithium for almost 10 years. So it could be that that's how lithium is affecting my GI symptoms these days. But it would be nice to feel confident that I knew that something was or wasn't going on." And we've selected this quote to speak about today for two main reasons. Well, a few reasons. First of all, a lot of people expressed this frustration of not getting any answers from the healthcare system, even after doing pretty extensive testing. Second of all, this person is speaking to how a co-occurring condition and the medications taken for that condition, in this case, lithium, could be affecting their GI system. And third is just that ongoing uncertainty, not knowing what's going on, not knowing what's causing it, and if something really is sort of causing trouble. The next quote from an autistic adult reads, "Well, the reason I had gone to them was because the emergency room referred me. I was so sick that I could barely stand. It felt like I had swallowed a rock and it was stuck in my throat. And I didn't know what that sensation was, but I couldn't take it anymore. And all these gastro symptoms I had. I went to the ER and I told them, it feels like I have a rock in my throat and all these other symptoms. Then they started asking me how I swallowed the rock. And that pretty much sums up the healthcare I've received in my life. That wasn't autism. That is our healthcare system." So this one it sounds a little ludicrous to think that someone actually thought they had swallowed a rock. But I think it's speaking not only to, the person's frustration with the system, but also this disconnect in communication. And this last quote reads, "So I'm having a lot of these extra tests done, and then it's getting really expensive. And I feel like if I had doctors that were more understanding of autism and neurodivergent individuals, that they would have, I guess, a better, obviously I don't fit the box. So that's my struggle right now, is that I'm having to actively find a doctor that is going to think outside the box because I've been dismissed as anxiety or drug seeking or something else." So here, really speaking to the need for providers that specialize in this population and feel confident treating autistic adults and other individuals with neurodevelopmental disabilities or who are neurodivergent more broadly. And then also this unfortunate experience that we hear quite a bit of people being dismissed as simply having anxiety or drug seeking. That is something both parents and autistic adults actually expressed. And the last theme we'll share today is that autistic adults relied on medications, extensive planning and preparation, avoidance of triggers, and positive supports, such as family or friends, to help prevent and manage their symptoms. So this first autistic adult says, "Absolutely, Remicade has been practically a miracle drug since I've been on it. It's been even more effective than Humira was. I don't have to administer myself, which is nice. It's been just a really good medication. That's been very helpful, and also getting colonoscopies about once a year or so, especially the first two times that I had a colonoscopy. Well, first was when I was diagnosed, and then second, removed a lot of potentially concerning ulcers and polyps and that kind of thing. So getting colonoscopies done is definitely helpful. I would say this is the rare example of someone stating that they actually had something that worked really well for them. So we wanted to share that. Sometimes there are treatments that actually can be treatments and procedures that can be incredibly helpful for people. This next adult says, well, one of the things I do is that have a bowel movement. And also there are times when I take these anti-diarrheal pills and also take Pepto. This is something we also heard, is that having a bowel movement could be helpful for relieving symptoms. But also adults often had to rely on medications like anti-diarrhea pills or Pepto-Bismol for symptom relief. The next quote is from a parent who stated, we live in a beach community. So when we go to the beach, we always try to plan our visit to some place that has a bathroom very close by that he can walk to so that he can get there if he needs to. And if we tell him we're going somewhere like a hike or something like that, he's not usually down with that. So this again, it speaks to not only the impacts that these symptoms can have on people's ability to go out and do things like go for a hike, but also the steps that they take to prepare for the possibilities of experiencing GI symptoms when they're out. So making sure that wherever they're going has a bathroom available. And the last quote that I'll read is, one thing about my particular brand of autism is I'm always prepared for things. If I leave the house, is there something I might need that I never need, but I'm going to take with me anyway? I have all those supplies in your car that you'll ever need, and some of those things are GI things. So again, speaking to the extensive preparation that autistic adults and parents did in the event that they might experience some GI symptoms when they're out. So next, we will move to some preliminary recommendations that our team developed based off of these interview themes.
So before I get into all the recommendations, I want to just say that a lot of them were carefully developed to be intentional with how we're going to share these and make them accessible for all levels of communication and all levels of accommodation, to make sure that, you know, any different levels of communication modality, be AAC users, people who utilize sign language or other types of communication, will be able to access and utilize any of these recommendations. Also, as an overarch, trauma-informed care will be a priority in any and all recommendations where that is needed, like with education or with training. So with that, I'm going to move on to the first of our 8 recommendations. And so the first recommendation is probably no surprise to anybody, healthcare provider training. This is an unfortunate but very common need in all aspects of autism, but especially in autistic individuals experiencing gastrointestinal health issues. We hope to kind of start this provider training with a needs assessment and from providers themselves, kind of expressing and understanding the challenges that they're facing any sort of adaptations or interventions that they've already tried to use in the past. Training can include educational information that's specific to autism, but in addition to that, the gastrointestinal symptoms or conditions that are more commonly seen in autism. We'd hope that this training could maybe help build provider confidence in taking care of autistic patients, especially in communicating with them. Our next recommendation is advocacy training for healthcare experiences. So, there's quite a few topics that would include, but, how to communicate GI issues that the autistic adult is experiencing with a healthcare professional, how to express the impact that the GI symptoms or issues are having on their daily life, what an autistic adult can expect from a healthcare appointment, as well as how to get the most out of a healthcare appointment with a doctor. There'll be different versions of this training to accommodate individuals across the spectrum. Like I said earlier, making this very accessible, but also could build on any sort of existing trainings that are out there on advocacy in general, as a very important topic for autism, but more specific to GI issues here. Our next recommendation is revolves around interoception intervention. So, this being
helping develop awareness of body signals and how to communicate those specific to GI symptoms with healthcare professionals or with others. We see this in anxiety, the interoception ability to know your heart rate is increasing, or maybe your breath is quickening, or your palms are getting sweaty, things like this, but related to GI. So how to kind of understand your body's small and subtle changes and be able to communicate that with others would be something very important to be able to develop that same awareness. Our next recommendation is about anxiety interventions. So this would include, helping understand the link or bidirectionality between anxiety and somatic issues that do include GI symptoms, or abdominal pain or headaches or things like that. And so there would be a focus on identifying that link or helping an individual identify that link within themselves, while also giving trainings or education strategies to reduce anxiety overall, as well as the physical symptoms that are associated with anxiety. Our fifth recommendation is an electronic gastrointestinal toolkit. It's kind of an online library of sorts of all of the different resources that might be beneficial or helpful. This stemmed from participants expressing frustration and having to kind of be their own online investigator to find all of these like niche different kind of resources that have been helpful. So, this online library could have educational articles or videos specific to GI and autism or the gut-brain connection, coaching videos, self-report tools or parent report tools for gastrointestinal symptoms and questionnaires, just kind of like a central focal point that people can rely on and utilize. And the sixth recommendation is revolving around nutritional goals. So there is the importance of this being very individual specific because, we want someone to be able to drive their own goals, and we don't think that any sort of blanket nutritional goal would be helpful. So trying to meet individual goals that would be like, I'd like to eat more fruits, or I'd like to eat more vegetables, or maybe I'd like to try one new food a week, or catering nutritional goals to specific food needs or requests, like I only eat soft foods or crunchy foods, and how to make more nutritionally dense meal options around those specific constraints, as well as reducing executive function barriers around finding nutritional meals. So that could be purchasing pre-sliced fruits or pre-sliced vegetables, or finding pre-made or pre-packaged foods that are nutritionally dense. Our seventh goal is a healthcare professional database. This again came up a lot about people traveling or willing to travel far distances to find professionals that have this experience with both GI conditions and autism. And so this database would be a collective of these healthcare professionals that have been identified and could filter, like types of insurance that they take or geographic area that they serve, any relevant certifications they have in specific GI conditions that they treat, their comfort level with different communication modalities, and their experience with autism. Our eighth and final recommendation is an interdisciplinary care model. So this is not necessarily a novel concept and can certainly be adapted from an existing model, but the importance being that focus of the whole person experience with healthcare. So it would kind of revolve around a caseworker or a patient care advocate, and they would help connect a patient with specific providers, help them navigate the scheduling of appointments, help them find affordable or accessible transportation to appointments, help navigate the difficulties of insurance requirements, send appointment reminders or other reminders, as well as provide follow-up or follow-through with treatments or specialty referrals.
Thanks so much, Maggie. So we're going to close by summarizing what the next steps are for this project. So as you've heard, these are the things that we've done. We really intentionally and deliberately developed our study team, a team with a really diverse set of professional and lived experiences that we felt could inform the study design, the analysis, the interpretation of findings, and then the recommendations. We recruited recruited individuals for that first qualitative interview and used a screening survey to select a targeted sample. We conducted that first qualitative interview in which we interviewed autistic adults as well as some parents of autistic adults about their lived experiences with GI symptoms. We are in the process of formally analyzing that data from that first interview. And as you've heard, we've developed some preliminary recommendations for how to improve the GI health of autistic adults. And we've received some preliminary feedback from our community board, which we've already used to revise some of those recommendations. And so what's coming down the pipeline is that we're in the process of beginning to schedule our second interview with those 26 participants. And the purpose of this interview will be to get really rich, detailed feedback on those recommendations, to hear whether the autistic population feels that those recommendations would actually be helpful and meaningful and appropriate and acceptable to them. In parallel to that, we'll be administering a quantitative survey to about 700 autistic adults, as well as some parents of autistic adults, to also receive feedback on those recommendations and to identify which subgroups of the population are more likely to endorse or reject particular recommendations. And so as an example, we might find that the anxiety intervention recommendation that we developed is something that might be highly endorsed by parents, but perhaps not endorsed by autistic adults. That's just a hypothesis based off of some of our initial community board feedback. And so we would want to do that to understand whether there are some recommendations that we simply should not pursue or really want to pursue, or perhaps whether there are recommendations that we target to different subgroups. And half of those participants from that quantitative survey will come from Spark for Autism Research Match, and then half will come from other recruitment sources. And then lastly, we'll take the feedback from that second qualitative interview as well as this quantitative survey and do a final revision of our recommendations. And then we'll actually disseminate those final recommendations and move forward with a subset of those projects. So at this point, we want to thank our amazing study team. Almost everyone is listed here. There are a couple of people that didn't want their names listed, but we want to recognize them as well. And this is a photo of, again, most of the people on our study team. It just honestly warms my heart to see all of these beautiful faces. The feedback that we've gotten from our study team has been incredibly, incredibly helpful. We just feel so grateful to them. Last but certainly not least, we want to thank our funders. So first of all, AIRP, who's hosting us today, for funding this study. And next, the Autism Science Foundation that granted us an accelerator award to expedite this study and help expand upon it. So thank you to AIRP and Autism Science Foundation. We have some references here, and we're always happy to get in touch if you have any questions or comments, and I'll leave it to Brianna to cover the next few administrative slides.
Yeah, absolutely. Well, first of all, thank you so much for your presentation and your work in this area. I think as you mentioned before, we do have time for questions and answers, so I'll give the audience a chance to think of some things. And in the meantime, you're also available or welcome to take our survey, as well as sign up for our next webinar. That will be for Dr. T.A. Meridian McDonald. She'll be talking about the NIH funding gaps and how that relates to autism. So that is what that link is for. And then I'll also drop the survey link in there. Thank you. I guess I have a slight question for you. I don't really know if it's maybe more of a comment. I'm blown away and fascinated. It's so amazing. But we're working on a disability curriculum over here at AIRP and a little bit in Lend. And I'm not sure how much overlap there is, but have you talked to anybody about the development of that here? And when I talk about, sorry, disability curriculum, I'm talking about for providers and clinicians specifically.
And sorry, Brianna, do you mind repeating the question? I was just looking at the chat and I didn't fully hear what you said.
Oh yeah, no problem. Sorry. As far as like training for clinicians, have you worked with anybody from our team? Because I know that some of them have been working on a disability curriculum. I am not, I should preface, I do not have a research background. So I'm very green to all this, but I know that there are individuals, faculty and staff working on that. So might be some overlap.
That's a great point. So we haven't at this point really reached out to any particular individuals, but we have heard from some of our community board members, some of which are already part of AIRP, that those efforts are happening. And so the very first thing we would do is if we move toward with prioritizing and following that recommendation, we would reach out to AIRP and some of the other organizations that we know are involved in those efforts to make sure that we're not reinventing the wheel. So it's important for all of these recommendations that we really look at what's being done and what are the gaps, and expand and build on any of those efforts rather than starting anything from scratch. So we would definitely reach out to AIRP for that.
Absolutely. Thank you.
Sure.
Again, I was like, I don't know if it's a question or a comment, just something to say.
No, it's a great point.
And would you mind, like, maybe nobody has a question now, but if we wanted to share your email perhaps on like our website or social media or continue to at you, we could do something like that.
Yeah, that's certainly fine with me. Both of our emails are in the slides. And we'd be happy to connect with anyone who has questions or feedback or any thoughts about the presentation or the topic more broadly.
Perfect. Thank you. Well, I don't want to hold anybody too much longer than they do. Let's see.
I think we got a comment or a quote.
Yeah, I can read it out for those. Clearly a needed area for research. I appreciate your thoughtful approach as well as your practical recommendations. I love qualitative research. The quotes you shared were powerful. I work with young children, often not communicating well yet. I will think about what these adults have shared as I work with them in their families.
Thank you so much, Meg. And, you know, of course, we focused on autistic adults for this study. I will say that during my dissertation, I helped lead a qualitative study of autistic children in which we interviewed their parents, and sometimes the children were also joined for the interview. I can pull up that reference and put it in the chat in just a second. You'll find that some of the themes are similar, but if you work with the pediatric population or are interested in that, you may find that study interesting as well. So I'll pop that in just a second.
And then somebody else, Jack Richards, mentioned as a CHW who is also autistic, I'll definitely be using some of this to help patients feel less alone and to help them advocate for themselves. Thanks, Jack.
Thank you, Jack.
Give it just another minute or so, just in case anything lasts. I know it's a lot to digest. Last comments or questions come through. Otherwise, thank you again so much. You should stick around for just a moment.
Yeah, and hopefully we can come back sometime when the whole study is wrapped up and we can share the updated findings. And
oh yeah, absolutely. Anytime. You have a whole, I don't know, until the end of our grant to do so. So whenever you're ready, we're ready for you.
Thank you. Thank you for the comment.
Yeah.
Yeah, all the wonderful comments. I feel like that's a nice way to end things. So again, wonderful job. Thank you so much. Thank you for everyone who attended, and we'll be in touch. So take care. Have a great
Thank
day,
you.
everyone.
Thank you.
Bye.
Thanks. Bye.